Good afternoon. My name is Ismira Yusufova, and I will be going over my individual teaching and learning plan for fundamentals of nursing practice. I chose the fundamentals course, which is a first course in level 1 accelerated BSN program. And before this course, students take prerequisites such as biology, chemistry, and psychology, but they have never learned anything about nursing skills or patient-centered care. They also take core requisites, which are 4 nursing courses. The course has 8 objectives, so there is a lot to be covered in this course. And in the description of the course says that the course focuses on principles and practices of culturally competent nursing care. The term culturally competent is actually outdated, and a more useful term is cultural humility, which implies that we are always learning about cultures and we can never claim competence. I would recommend to actually change description of this course. I want to focus on the second learning outcome, which is provide culturally competent patient-centered care to individuals, families, groups, and communities. I chose this because as a holistic nurse provider, I value individuals. I embrace diversity, equity, and inclusion, also known as DEI. I value cultural diversity and unique attributes of individuals. And I think that nurses in the current health environment and healthcare need to know a lot about patients and take it into consideration, such as cultural language and spiritual beliefs. Because time is so limited in this course, there is a lot to cover. I will only be spending 15 minutes to go over my objective. I looked over the topics in the course. I was able to find 2 of them to fit my needs, which is Foundations of Nursing Practice. The topic was to teach cultural and linguistic and ethnic considerations. And the second one, under Basic Human Needs, Spirituality, was listed. So I combined those 2 because they're related and they contribute to patient-centered care. By the end of my class, students will be able to define DEI, culture, spirituality, spiritual care. They'll also be able to list 4 to 5 cultural ethnic considerations and client care, and they will be able to learn a FICA assessment. This is what it looks like, what I was just describing. What am I teaching? If we think back to Bloom's taxonomy, which was revised, we know that there are 4 types of learning: factual, conceptual, procedural, and metacognitive. Because they're just beginners, I will be focusing on factual knowledge through lecture and peer learning, and conceptual knowledge through flipped classroom and role play. To meet my first objective and be able to define these concepts, I will spend 15 minutes of my class and use flipped classroom. There was pre-assigned work for the student, and that advantage of doing a flipped classroom is that students read up on a concept and show up to class and able to contribute. I also like technology, so I will be using an app, a website called Socrative, and that's basically to quiz them, to provide short answers. I hide the short answers and then I reveal it. It's anonymous, and we read definitions. That's called peer learning, so students can see how each person defines culture, spirituality, diversity. And then it can lead to a rich discussion, and then I will be able to lecture on these concepts using PowerPoint and the literature definitions. This is what it looks like visually. I'll go over my pre-work in a little bit. The second concept that I wanted for them to know is to list 4 to 5 cultural ethnic considerations in client care. So we will be discussing things like, what are the predominant religions in the US, what is their role, and how can they provide care. This will be accomplished through flipped classroom and lecture again. Lastly, I want them to work in pairs, in groups of 2, for parent share and role play. This will take another 15 minutes. And what it will allow students to do is to mimic patient behaviors and improve their interpersonal and communication skills. We all know they need improvement in that. And the students will act as patients and use FICO assessment tool. This basically, they ask each other 4 questions. We know that group learning and peer learning is an effective teaching strategy. My class will conclude with a 5-minute wrap-up. I did not give them any breaks because it's only 50 minutes. So the last objective is met through pre-work. I gave them a YouTube video to watch. So let's go into more details around that. I looked through the books. There are many books assigned in this course, but I wasn't able to find anything on DEI, cultural competence, and spirituality. So what I did, I assigned an article and a video. Before they showed up to class, they had to take a quiz because I put these things under adaptive release technique. So they had to watch the video, download the article, take the quiz, and then they would have access to my PowerPoints before they show up to class. The article is extremely short. It's only 4 pages, written in a simple language. It's called The Essence of Spiritual Care, and the authors discuss nurses' role in spiritual care. A YouTube video shows how to do this FICO assessment. It's exactly 5 minutes, brief and simple, and I understand that students are not going to spend too much time on this. And those are the questions from the FICO assessment: faith, belief, importance, community, and address. How do I evaluate my students? Well, any learning needs to be evaluated. I will use both summative and formative evaluations. For formative, on the unit exam, I will put 5 to 6 questions from this content. And another way to do formative assessment is for FICO assessment. We are doing the formative assessment there, how to do the FICO, and then they can actually use it in clinical setting. For summative assessment, 2 to 3 questions from this lecture can end up on the final exam. And that's what it all looks like. Thank you for your time.